The Joy Business Health and Wellness Trade Show comes off today, Thursday, May 24th at the Accra Digital Centre. It's bringing many exhibitors in the health industry to one venue so you can meet all your health needs at one place. Let's cross over to the Accra Digital Centre.
Healthcare, access and affordability. This is a platform to learn, to connect and to shape the future. You're all very welcome. I personally look forward to some groundbreaking outcomes over the next 3 days. Now, of course, we want to get active on social media, so if you want to follow the conversation and contribute, the hashtag you need to use is JoyBusinessHWTS. That's JoyBusinessHWTS, and we're on Twitter, Facebook Live, across all the multimedia platforms, both here in Accra and in Kumasi, on JoyNews channel, and also on Joy FM. The Joy Business Health and Wellness Trade Show is made possible with the support of our partners, which includes Safe Doctor, your mobile hospital, Apex Health Insurance, your preferred health insurer, NS Chemist, providing quality and affordable medicines, Interstar Eye Clinic and Laser Center, and endorsed by the Ministry of Health and the Food and Drugs Authority. Ladies and gentlemen, help me welcome, with a round of applause, the MD of Multi TV, Mr. Santok Singh, to start us off.
Good morning. Again, good morning to special invited guests, sponsors of this event, ladies and gentlemen. Today is the opening of the first maiden edition of the Joy Business Health and Wellness Trade Show, which will span for 3 days. We are happy to receive all of you here, and I notice we have a good representation of diverse agencies and organizations in health and wellness, such as Ministry of Health, Ghana Health Service, Food and Drugs Authority, Ghana Standards Authority, Medical and Dental Council, Pharmaceutical Society, Chamber of Pharmacy, and of course those in alternative health sector. The health and wellness industry is key to our very survival and providing appropriate health service to our population, and is vital. We know the challenges associated with this, right from the infrastructure, access, affordability, and also the low number of health professionals attending to patients. But there are also a bright side where the appropriate policies and supports can mean these issues are addressed. The government has announced its intention of making Ghana a pharmaceutical hub, and the use of technology, one of it is such as use of drones in the health industry. I'm sure we'll hear more about these initiatives through the various speakers that will speak today. So a bit more about the trade show, which will focus on the general health and wellness industry, healthcare, pharmaceutical, herbal, and treatment, with exhibitors and businesses from these industries. Primarily, it's a B2B event, but we are also driving B2C engagement and activities. Besides providing the platform for exhibitions, the trade show will discuss issues such as new technologies, new business models, and partnership to support innovation and transformation. The big question is how the diverse businesses in this space tap into innovative trends to create value and sustain competitive advantage. There will be also activities for direct consumer engagement and specialized discussion for general well-being, deliberating health issues and also concerns. We urge the general public to also participate, to visit the trade show, and take the opportunity to check their health status, and also take advantage of the businesses in healthcare and wellness who are here, including insurance, alternative medicine, and also importantly, you can also donate some blood. I would like to recognize the major sponsors of this event as well: Safe Doctors, your mobile hospital; Apex Health Insurance, your preferred health insurer; NS Chemist, providing quality and affordable medicines; Interstar Eye Clinic and Laser Center. I mean, this event couldn't have been done without their support. So a big clap to our sponsors. And I also would like to say a big thank you to the Ministry of Health and the Foods and Drugs Authority for endorsing this event. They have given us a lot of support in organizing this event, so I say thank you. So with this, I'll say thank you, and once again, Akwaba. Thank you.
Thank you very much, Santok, for the welcome address. We'll be moving on straight into a series of presentations, starting with research and development in health and wellness. Ghana, the next big thing. It's a very good question that we need answers to, and to prime our minds and get us ready to appreciate what the opportunities out there are. Ladies and gentlemen, help me welcome with a round of applause Professor Alex Dodu, Director General at the Ghana Standards Authority.
Thank you very much, Mr. MC. I think in the 10 minutes or so that I have, I want to leave you with what you should take home, that Ghana is open for business, that the pharmaceutical sector is open for bigger business, and that if you are thinking of where to put your investments, look at the pharmaceutical and healthcare sector. I'm sure you're all going to wonder why I'm making these bold assertions. And so I'll start by letting you know that there are three main reasons. One is the need. Two, the opportunities. And hopefully we'll look at, let's say, the potential. Africa's population of close to 1.5 billion means that we have a lot of people who are going to need medicines. Whether they are well to make them feel better, or whether they are ill, they will need medicines. So already we have the population. Secondly, Africa's disease pattern is changing. It used to be communicable diseases like infections, malaria, TB, HIV. By 2030, non-communicable disease, high blood pressure, obesity, cancer, will kill us more than communicable diseases. Now, chronic disease is always good business for the pharma sector because they stay with you for a long time. We don't treat high blood pressure, we manage it. You take the medicines repeatedly. So what we are looking at is that, one, Africa is having what we call the double whammy. Communicable disease, non-communicable diseases. They will be treated by medicines. So the potential is huge. And we're really expecting that by 2020, maybe cancers will account for about 22% of all deaths, high blood pressure about 45%, diabetes 4% and rising. This is across the African continent. Now, we have the population, we have the diseases, but I think the good news is that the pharmaceutical sector is there, not to make you ill or wishing that you are ill, but we know that in case that you fall ill or you are among the worried well, we want you to be healthy, we want you to be happy, we want you to live longer. And take this message, the pharmaceutical sector is a multi-trillion, should I say it again, multi-trillion dollar industry. And Ghana cannot stand back and do nothing. So what are the opportunities? First and foremost, the Sustainable Development Goals make it imperative that we should work hard collaboratively to ensure that we end HIV/AIDS, tuberculosis, malaria, and other neglected tropical diseases. But also, SDG 3.8 says that we must increase access, universal health coverage, including access to safe, effective, good quality medicines, vaccines, and other remedies. So you have a condition, you have medicines which can do it, and there's a call globally that we should work together collaboratively to solve these problems. Let me give some figures for those who are into finance. Healthcare spending across board, including pharmaceuticals, is expected to increase from 7.8 trillion to about 18.28 trillion by the year 2040. Should I say it again? I mean, multiply Ghana's economy a few times. So if we are looking at growth within the next 20 years, up to 18 trillion and beyond, then we're talking about big business. Now, what are we going to do about this big business? We know that pharmaceuticals alone will account for at least 3 trillion of this spend. We know that in developing countries, including Ghana and across Africa, the middle class is growing, it's going to be about 34%. We know that the potential for the pharma sector in Africa is growing to billions, and that our economies are growing very fast. We know very well that Africa is now the destination for foreign direct investments. There is a boom in all sectors. A classical example is going to be the boom in mobile phones, where we now have over 600 million subscribers in Africa, which is higher than you have in America or Europe. Africa deserves a clap for that. For once, we are taking leadership in some areas. Now, from a business side, Africa's demography is changing. By 2050, 34% of Africans are going to be in the middle class. More Africans will be living in urban areas compared to China and India, which means that the potential for business is high. With all this going on, Ghana cannot stand idle by. We should be the place where leadership in the pharma sector starts. But before I talk about what Ghana can offer and what Ghana should offer, let me just tease you with what is happening in Africa. Already, if you look at North Africa, Algeria, Morocco, Tunisia, growth in the pharma sector has just gone through the roof. Initially, when the major pharmaceutical companies came to Africa, they started from Abbott in the 1930s in South Africa, Sanofi in Morocco in the 1950s, Novartis went to Egypt, then Pfizer went to Morocco before GSK came to Nigeria in 1971. Even though they have grown, most of their job have been just about marketing, not about research and development, not about looking for products which are indigenous here and that can be exported. We have sat down as Africans and have seen the Asian economies dominate the African pharma space. So as we sit here right now, about 20% of all our pharmaceutical imports are from Asian countries. It's a good thing, it's pure business, but are we going to be just importers of medicines, or are we also going to rise and join the team? My view is that Africa should rise. Already there have been giants in Africa. We can mention Aspen and Adcock Ingram in South Africa. Adcock Ingram has acquired a few companies in Ghana at the moment. We have Cipla in South Africa as well as Sidal in Algeria. Africa's pharmaceutical sector have had two challenges. The cost of doing business in Africa is very high. Bringing active pharmaceutical ingredients for both the pharma sector and the healthcare sector is very high. The cost of doing business is very high. Tariffs are very high. In addition to that, our quality has often not matched up to what is expected globally. So we have a challenge of high expense and weak quality. But that is changing. That is changing. And I'm going to ask Ghanaians whether we are ready for the next big thing. Ladies and gentlemen, Ghana has everything it takes to be the next big thing in pharmaceuticals. And let me give you just a few reasons why Ghana is the lead and why, if you are a business looking at the pharma sector, Ghana should be your number one location. First and foremost, Ghana has all the required ingredients. And let's start by the workforce. We have 3 schools of pharmacy in Ghana, training people to the best quality in the world. We have 5 medical schools, 4 public, 5 private, and quite several and nursing training institutions. We have world-class research institutions. Speak about the likes of the CSIR and Noguchi. Noguchi was the place where most cases of Ebola or other conditions are brought here for us to test and see whether these things are really true or not. So we have the human resource. Make no mistake about that. We also have a strong quality infrastructure. The Ghana Standards Authority exists with at least 7 accredited laboratories to provide the quality infrastructure needed to service the industry. And Ghana has an excellent regulatory framework. We have our Food and Drugs Authority, which is stringent in how it manages clinical trials and clinical trials inspection. We have the Public Health Act, which makes clear provisions for how Ghanaians can go about developing medicines for both the pharmaceutical and the healthcare work sector. So, the question to Ghanaians is that, are we ready for the next big challenge? If you look at the wellness sector, shea butter, lemongrass, how many Ghanaian companies are producing scraps? You go to Europe and America, and scraps are the order of the day. Mango scrap, lemon scrap, whatever scrap, for the beauty industry. Makes you feel good, but it provides money in the pocket. The cosmetic and wellness industry is worth billions of dollars. In Ghana, I don't think we are even making $1 million. Yet we have the ingredients, we have the human resources. So my take to the country is this: the time to rise is now. There are about 3 or 4 big pharmaceutical companies trying to establish in Ghana. We need more. We are producing not for local consumption, but for local consumption as well as for exports. Can Ghana match up to the Indians and the Chinese of the world? The answer is yes. Government policy is to stimulate the sector by the establishment of a pharmaceutical park or a pharma park. Our call is that let all players come together to get a pharma park going. The 4 players on the horizon are few. Lower interest rates, you know the bank rates are coming down. So, whilst thanking Joy FM for this bold initiative to start the Pharma and Health and Wellness Fair, let us begin to move away from the Ghanaian attitude of being shy of talking about money. Human existence thrives on trade. From the Bible to the Quran, it's all about trade. But fair trade, honest trade, genuine trade. And a rich country is a country where people make a lot of money by their hard work. Every transaction you undertake is trade. Whether it is a doctor serving the patient, it's trade. Trade in a service. So, my call to Ghanaians is that let us be bold and confront the issue that the pharmaceutical sector is worth trillions. These trillions can transform the fortunes of Ghanaians, can make Ghana the paradise that we want. But to go into that sector, there are rules that we must follow. Quality is not negotiable. GMP, good manufacturing practice, is a must. But if we put our minds to it and we look at this as business that will yield profit to the national coffers as well as to individuals, business that will transform the lives of our youth, business that will make Ghana a place where everybody wants to come to, then we would confront that business with anything but quality and standard to ensure that at the end of the day, Ghana is the next big thing in the pharma sector. I believe that Ghana is ready. I want to believe that all of you will join us to make Ghana the next big place for the pharmaceutical sector. Thank you very much.
Thank you very much, Professor Alex Dodu. And indeed, the stage has been set, our minds primed to look beyond where we are today. Indeed, a lot of the drugs we use in this country are imported, and most of you would have come across some that came from India. When we have the Q&As, I'm sure we'll get an opportunity to try and understand how they did it and how we can balance the opportunities that stare us in the face with the aspirations that we've set for ourselves. I'd like to welcome the head of Safety Monitoring Department at the Food and Drugs Authority, in the person of Mr. George Sabla, to do a presentation on does a drug work and is it safe? Pharmacovigilance, good drugs giving a bad name. Let's welcome him with a round of applause.
Good afternoon. First of all, I bring a greeting from my CEO, who would have loved to be here herself, but she's engaged in a very important assignment outside this country. She's a passionate believer of pharmacovigilance and patient safety, so greetings from her. When I was asked to come and do this, I was like, Professor Dodu is here, so who is more qualified to talk about pharmacovigilance than him? But the good news I have for you is that he's been training people to do his work for him, and I'm privileged to be one of them. So, Prof. Dodu, thanks so much for the mentoring. I think I'll give him a hand for that. Okay, I've been asked to talk about a very long topic, which I call preventing good drugs from having bad names, the role of pharmacovigilance. My talk will follow this order. I'll give you a brief overview of pharmacovigilance. I'll talk about what's happening internationally and come down to Ghana, what we are doing in this country. I'll talk about how could a good drug become a bad drug, and then how we can redeem these drugs. And finally, I'll tell you what I've told you in just 1 minute. First of all, medicine development has gone through a lot of changes in the 21st century. And you know, all of you know that medicines are used for 3 things. They are used for treatment of disease. If you happen to be sick, medicines come handy to cure you. They are also used for prevention of disease and also for diagnosis of some conditions. And medicine, just like any other medical interventions, do not come without risk. Anytime you make an intervention using a drug, there are some level of risk. Be it a herbal medicine or anything, there are some level of risk that you are exposing the patient to. And the World Health Organization estimates that in Africa, about 50% of the population do not have access to essential medicines. That's good quality, safe and effective medicines, like in about 50% of the population do not have. Now, what it means, therefore, is that if we want to achieve this, the Sustainable Development Goal 3, we will have to improve access to medicines. And there are some disease conditions that are prevalent in our area, in Africa, in Ghana in particular. As at the moment, we are looking at vaccines that can prevent malaria. We are looking at new drugs. So what it means is that if you are bringing new drugs and you want to achieve the SDG number 3, what you are doing is that you are introducing drugs that are used for medical conditions in our setting. You need to set up systems that can pick up safety issues of these medicines. So pharmacovigilance comes into play. And what is pharmacovigilance? Pharmacovigilance simply is about identify safety issues of medicines that were not picked up during clinical studies. That's simply what pharmacovigilance means. But I'll take you back a little. Pharmacovigilance basically is derived from 2 languages, a Greek word called pharmakon, which means drugs, and vigila, which is a Latin word meaning to keep awake or to keep watch over drugs. So pharmacovigilance simply means to keep awake over drugs or to keep watch over drugs. Now, what's the objective of pharmacovigilance? The objective of pharmacovigilance, as I already said, is to identify safety issues of medicine that were not picked up during clinical trials. And also, like I said, if you are introducing drugs to any human being, you are introducing a level of risk. So pharmacovigilance comes in to optimize the benefits and minimize the risk of any treatment that you are giving to a patient. Now, pharmacovigilance, the objective of pharmacovigilance, I already say, is to optimize risk, optimize the benefit and minimize the risk. And you do this because there are limitations of clinical trials. Clinical trials are limited. What are clinical trials? Before any drug or any health product is introduced for use, it goes through what we call clinical studies. You need to try the drug and see if it works well in healthy people or diseased population to make sure the drug works. But there are several limitations of clinical trials. I will talk about just 3 this afternoon. The first one is that the numbers that are used in clinical trials are limited. In a clinical study, the drug is used in hundreds and a few thousands of people. But when the drug is introduced for use in the general population, you have millions of people using the drug. What happens if the adverse event that you are interested in occurs, maybe 1 in 1,000?